So I'm gonna stand outside of his door. He is, has a stomach bug. So I'm just gonna put on my contact precautions, which is just my gown and gloves before I enter the room. Good enough. I would do hand hygiene and my gloves. Okay, so I'm just gonna observe from the door, watch how he interacts with mom, just to get a good and bad, just how he's, like his overall health. He seems to be okay. He looks a little pale, probably dehydrated and everything, but so far everything looks good. So I'm gonna enter the room and make sure that I provide privacy. Hey guys.
Hi.
My name is Dally and I'll be your nurse today. I just have a few of the doctor's orders that I'm came in to do, but I just wanted to talk to you first, ask if you had any questions or anything. Did the doctor explain kind of the procedure for today?
No, I'm not really sure what he has.
Okay, so he has gastroenteritis, which is just like a stomach bug. And there's not a whole lot that we can do for that other than he has been throwing up and had diarrhea. So we will give him some fluids just to keep him hydrated, as he can't really keep anything down. And then he also has an ear infection. So I brought some amoxicillin for that to give to him, which should help. And then some Tylenol to help with his fever that he's been having and any pain and discomfort. So we'll just do that. Wes, I'm just gonna look at your name band. Can you tell me his name and date of birth?
Wes and 2022.
Okay, perfect. How are you doing, buddy? Good. I'm just gonna check a few things out and make sure that we can get you feeling better so you can get back home to play, okay? I'm gonna put this down just so that I can interact with him more, and then I'll put it up once I leave. So I'm just gonna start with the general assessment and get his vital signs. So Wes, I have a few things that I'm gonna put on your arm, and it's just gonna tell us how strong your heart is, okay? It's not gonna hurt, it's just gonna give it a little squeeze, your arm a little squeeze. You can squeeze mom's hand while it's doing that too, okay? This is a big cuff, I would get a small one for a child. While that's taking his blood pressure, I'm just gonna put this one on your finger so you can tell us how well you're breathing, okay? Make sure that you're doing okay. While that's going, I'm just gonna get your temperature. I'm gonna put this in your armpit. Can you squeeze it for me? Perfect. So his temperature is 39 degrees Celsius, so it is elevated. We want that between 36.5 to 37, 37.5. And that's why we brought the Tylenol, so it'll help with that.
Okay.
His blood pressure is 80/55, which is a little low. We want that 45 to 60 over 90 to like 105, but it's pretty okay for given his circumstances. Let's see this up. We'll just check this. So his pulse is 110, and we want that 80 to like 120. So it's within range, but on the higher end. And then his oxygen is at 94, which is a little low as well. I assume he's in pain, which is why he's just kind of struggling to breathe. But overall, he's doing okay. So, Wes, can you look at this and tell me what face you think shows how you're feeling? Are you happy? Are you just okay? Or are you pretty upset? You're about here. Okay, so you gives us a 6 out of 10. which is not great, but we will give the Tylenol to help with that. Alright, Wes, I just need to measure your head. Make sure you have a big, strong head, okay? I'm just gonna go right above your ears, so be really strong for me, okay? So that's about 39, which is normal for him. And then I also need to measure your belly. Is that okay? I'm doing this because he's under 3 years old, and we just need to get these accurate measurements. And that is 49. So you are growing right on track. You're doing so good. And then he is alert, oriented. Everything looks good. I can tell that it's just the stomach bug and the earache that's bothering him.
Mm-hmm.
So his Glasgow score is going to be a 15. Okay, Max, I need you to, or not Max, Wes, I need you to close your eyes, and then I need you to open them and watch my light for me, okay? Perfect. Good job. And I'm just going to look in. Can you open and say, ah? Your mucous membranes look okay. Everything looks good there. I'm just gonna check your IV. Did it hurt when they put it in? Yeah, but it's okay now. It looks okay. Nothing's wrong with that. That's good. We don't want to poke you again, so be really careful with it, okay? I'm gonna check his cap refill. Make sure that's good. His skin turgor. All of its extremities look really good. I would take his socks off and assess his toes also. They are nice and healthy. And then I'm just gonna, can I have you roll over and look at your mom so I can just check your bottom? We just need to check, because he's been having diarrhea, we need to check his skin and make sure there's no breakdown or anything that we need to be watching out for.
Okay.
I'm just gonna slide your pants down a little bit. And roll over there to mom. Yeah, perfect. Good job. Okay, I'm just gonna listen to your heart. Have you seen him use this before? Yeah, you like it? Okay. You just lay still for me, okay? And I'm just gonna listen to your heart. Oh, perfect. It's nice and strong. Listen to your lungs. And I would do the back too when he was rolled. Okay, I'm gonna listen to your belly. I know you've been kind of sick, so you just need to make sure that everything sounds okay. So I'd assess it first, make sure nothing's distended, not sunk in or anything, and it looks okay. So we're just gonna listen. He's pretty active. You can tell he's been a little sick.
Yeah.
Okay, I'm just gonna push on your belly and you tell me if it hurts, okay? Does it hurt when I move my hands off of there? Yeah. How has he been diaper-wise? Has he had very many today?
He's had like maybe 4 that are like diarrhea and pee, but I don't know which one's more.
Can you tell if the urine has been like a different color, or does it look okay?
Yeah, it looks really yellow and it kind of smells like pneumonia-y.
Okay, he's been pretty dehydrated, so that is to be expected.
Okay.
So just every time you change a diaper, will you just set it to the side and call us in so we can just check and make sure that we're replacing it the way that it needs to be done.
Okay, yeah.
So it looks like he has had 120 out in stool.
Mhm.
So what we're gonna do is replace that with fluids.
Okay.
So I will do my bolus as well as my maintenance. And then we'll also do an additional 120 right now over like the next 2 to 4 hours.
Okay.
To replace what he's lost. And then we'll reassess every few hours to see what else we need to add.
Okay,
Is that okay?
perfect. Yeah, that's great.
Okay, and then like I said, I have these medications and things. Do you have any questions for me before I get started on them?
I don't think so. I think that we're okay so far.
Okay, and Max, I brought this hot pack for you. This, you can feel it. It's really warm, and it's just gonna help your belly to feel better. So do you wanna just hold it right here on your tummy? And then if gets cold, let me know and I can bring you another one, okay? Alright. So, I'm gonna start with the fluid bolus just to get that running while I'm talking to the mom so I can change it out while I'm still in here. And we are just going to run this quickly over like the next 20 minutes. And my nurse is bringing me a IV pull. This isn't gonna hurt, Wes. It's just gonna go right into your IV and help you to keep peeing and staying strong, okay? So I prime my line, make sure it's ready to attach. I'm just gonna clean this really good so we don't get any other infections in you, okay? Scrub the hub for 30 seconds. And I need to make sure that I check the line first to make sure that it runs well. That's running good. And it is a bolus, so I would just turn it wide open and let it run while I'm sitting here doing the other things. Okay, next I'm going to do his amoxicillin. Mom, do you know if he has any allergies, anything he's ever had a reaction to?
Nope, he hasn't. He hasn't had any allergies.
Okay, so no like penicillin or anything that hasn't bothered him?
Nope.
Okay, perfect. So I've got 6.8 mils to give him to help with that ear infection. And then we will do the other Tylenol as well.
Okay.
Does he take medicine very well?
Yeah, he likes to push it in himself.
Okay.
That's okay.
I'll try it, and if it doesn't work, I'll let you do it.
Okay.
Wes, you wanna help me do this? So I'm just gonna put it in your mouth and you can push on this, okay? Good job, you're doing so good. I know it doesn't taste the best, but it's gonna help you feel better. Perfect. Okay, and then I've got my acetaminophen, which is just Tylenol, and that'll help with his fever and pain. I've got 4.3 mils of that, and that's calculated according to his weight.
Okay.
Okay, one more. This one's gonna taste even better, okay? You help me push it in? Perfect. Okay, and I know he just came back from x-ray. We'll wait on those results and see what else we need to do after that.
Okay.
So this is done. I'm just gonna set up his maintenance fluid, and that's gonna help also with the diarrhea loss, just to replace anything that has been lost.
Okay.
Scrub this one again for 30 seconds. I programmed this one to let it run 4.7 mils an hour, just to help maintain. So, Mom, any reactions that we would see with the amoxicillin is just like rashes, hives, trouble breathing. If you notice any of that before we do, will you just let us know?
Yeah.
So you can come in and do whatever we need to stop that. And then with the Tylenol, it could cause like a headache, or long-term use can cause like liver and kidney issues, but we won't have to worry about that because we'll just keep it in small, controlled doses.
Okay.
Okay. You feeling better, Wes? Is there anything else I can get for you?
Popsicle.
Well, I can go see what we have for that, okay? Alright, so I'm just gonna raise this bed rail, make sure he's safe. Everything looks okay. I'm gonna clean up my stuff and leave the room.